I'm curious, why do you feel that fathers have historically shown less involvement in formal parenting classes, parenting education? Like, what do you think that's about?
Yeah, I mean it's a really tough question, and I think we're still, as researchers, I think we're still figuring it out. A lot of the healthcare systems are geared around the mum, and obviously as mothers, we carry the baby, and there's a huge physical risk and a physical process in carrying babies, and a lot of the medical system is geared around supporting the mother and then the mother to give birth. But in the UK, actually, so when a mother gives birth in the UK, often the name of the dad isn't always captured. The details aren't captured in the way that mother's details are captured, and so there's this sort of reasons for doing that, but the focus is very much on the mother, and obviously the mother needs that support, but fathers have an important role to play as well, and especially as anyone who knows who's gone through a difficult birth where maybe the mother needs to recover. In the it's sometimes true that in the early hours of a baby's life, the father is the one with the baby because mum is recovering. So in those situations, dad, hospitals and perinatal care is very well set up to support dads as well, and recognize those dads as equal caregivers. But um, sometimes if a birth is actually a less complicated birth, then sometimes the dads may not be given the same role. And you have to remember that dads have really been in the delivery room since the 1970s. So before that, there was a kind of cultural expectation that dads might be in the waiting room, or they might be at the pub, or they may not even be at the hospital. So it's a very modern phenomenon for dads to be partners in the birth and to be really involved in the birth. And I think we're sort of catching up. And I think historically, um, a long time ago, probably, and this is something I need to research. And I'm not a historian, but I think historically, within Western medicine, probably the very first people involved in the study of obstetrics would have been male physicians and male medical researchers. So maybe the mother was seen as sort of the object of the study, and the child, and that was the focus.